Chances are you're watching this program because you have a cataract or are considering having a refractive lens exchange and your vision restored with Crystalens, the accommodating intraocular lens. During the next few minutes, you might want to take a few notes. We'll give you a brief quiz at the end of the program because we want to be sure you understand the information in this video. We also want to be sure that your expectations are realistic. Let's begin by considering how the normal eye works. An image begins as rays of light reflected from a scene. The light enters the eye through the clear dome-shaped cornea, passes through the pupil, and through the clear natural lens inside the eye. It is then focused on the specialized nerve cells of the retina. These cells convert the light to electrical signals and send them to the brain, which interprets them as images. For most people, vision remains relatively stable until they get into their 40s. Around that time, the eye's natural lens begins to gradually thicken and harden, making it difficult for the muscle in the eye to focus the lens. This is known as loss of accommodation, or presbyopia, and its earliest symptom is difficulty seeing things up close. Over time, it also impacts your ability to see intermediate images, distant images, and all the images in between. Eventually, the natural lens may become more dysfunctional and develop a cataract, which interferes with its ability to pass light rays to the retina. Once a cataract forms, the only way to see clearly again is to remove the dysfunctional lens and replace it with a clear intraocular lens, or IOL. When we are young, the natural lens can change shape, which changes its focusing power. As the eye muscle contracts, it focuses the lens on near objects. To go from near to intermediate vision, the eye muscle must slightly relax. When the eye muscle is totally relaxed, the lens is able to focus on distant images. Until recently, most patients received fixed focus IOLs. Their design prevents this type of lens from moving within the eye to change focus. Patients who receive a fixed focus IOL usually require glasses to see intermediate and near objects. The Crystalens is the first lens designed to mimic the eye's natural lens. This was accomplished by creating hinges next to the optic, the part of the IOL through which you see. These hinges allow the optic to move back and forth within the eye. When the eye muscles contract, the lens moves forward to focus on near objects. To go from near to intermediate vision, the muscle must slightly relax to move the lens backwards. When the muscle is totally relaxed, the lens is all the way back to allow clear distance vision. The procedure you will be having is called cataract surgery when a cataract is present, and refractive lens exchange when there is no visually significant cataract present. Over 2 million cataract surgeries are performed each year in the United States. But no matter how routine a procedure becomes, the decision to have surgery is an important one that ultimately only you can make. Your decision must be based on accurate knowledge of both the potential risks and benefits of the procedure. The only way to avoid surgical risks is not to proceed with the surgery. Your surgery will be performed on an outpatient basis. Only one eye will be done at a time. After the eye is completely numbed with topical or local anesthesia, the eye's natural lens is gently vacuumed away through a tiny surgical incision. Next, the Crystalens is inserted through the same surgical incision and placed into the capsular bag that originally surrounded the natural lens. This type of incision is self-sealing and usually requires no stitches. It remains tightly closed by the natural outward pressure of the eye. For your short and long-term success and satisfaction, it is essential that you strictly follow all instructions given to you regarding medications and follow-up appointments. After the procedure, have someone drive you home. You should just relax and enjoy the rest of the day and avoid any strenuous activity. Everyone heals somewhat differently, but many patients report improvement in their vision almost immediately after the procedure. Most patients return to their normal activities within a day or two. It is important that you understand that virtually everyone will experience a significant improvement in their vision after surgery. But some people will not see 20/20 at all distances or in all light levels. This can be influenced by the overall health of your eye and the condition of your retina. As we get older, our ability to see in low light may start to decrease, so it's always best to read in good light conditions. Everyone's focusing ability is different too. Although most patients are satisfied with their range of vision without glasses after the procedure, some people may be more comfortable with glasses at times, particularly at night or in dim light. You should think of your new lens as a body part that will get stronger month by month. Your distance vision will usually be good within a day or two. However, your intermediate and near vision may be somewhat blurry at first. For the first week or two after the procedure, eye drops will be used to dilate your pupil. This keeps the muscles around the crystal lens from changing its focus and is necessary to ensure the lens is correctly positioned as your eye heals. You will be light sensitive during this time, so you will need sunglasses outside and reading glasses to read during this period. After about 2 weeks, you will notice that your arm's length vision is improving, and your near vision is starting to get better too. It is important that you discontinue the use of the reading glasses at this time so that you strengthen the focusing muscle in your eye. It may take several months for your eye to reach its full focusing potential. The more you try to read without reading glasses, the quicker you will be able to read without them. Your vision can continue to improve for up to 12 months. The second eye will usually be done soon after you regain visual function in the first eye. The full benefit of having this unique accommodating intraocular lens will be even more noticeable when both eyes have been treated. Something that you will notice after the procedure, during the time your eye is dilated, is glare around lights at night. This should improve when the dilation drops are discontinued. However, as with any IOL, glare can be a problem at night, especially if you have large pupils. Occasionally, light can reflect off the edge of the lens in the periphery of your vision. If the glare bothers you, there are a number of things that your doctor can do to improve your night vision, including medications and driving glasses. It is normal to notice a difference in your vision from one eye to the other after your eyes heal. However, if the difference is significant, your doctor may recommend corneal refractive surgery to correct astigmatism or any remaining refractive error. Although lens removal with intraocular lens implantation is one of the safest procedures performed in medicine today, there is the possibility of complications arising both during and after surgery. Some of these complications include infection, retinal detachment, macular edema, glaucoma, IOL dislocation, IOL removal, loss of vision, and even loss of the eye. Also, should the capsular bag rupture during the procedure, another type of intraocular lens, other than the crystal lens, would need to be implanted. The capsular bag that holds the lens may also become cloudy at a later date. This can be remedied with a quick, painless laser treatment. This list is incomplete, as a short video cannot cover all of the potential risks and complications associated with refractive lens exchange, cataract surgery, and IOL implantation. You will be given additional information on this subject prior to having the procedure. Be sure you have all of your questions answered before you give your consent for surgery. Current data, based on cataract surgery outcomes, indicate that 98% of people have no complications after surgery, and more than 95% have improved vision. Although the percentage of these complications on a nationwide average is low, they vary from surgeon to surgeon. Be sure to discuss the various risk levels you may experience with your doctor. Implantation of the crystal lens is considered to be elective. This means you're choosing it because you want it, not because it is your only choice. Implantation of the crystal lens for refractive lens exchange is considered to be off-label because the lens was initially approved by the FDA for patients with cataracts. However, surgeons are allowed to use the crystal lens in patients without cataracts as well. The goal of implanting the Crystalens is to reduce or eliminate your dependence on glasses or contact lenses. It is important that you realize before the surgery that you may not achieve this goal, and your doctor cannot guarantee your results. In the FDA 2-year clinical study, results indicate that 92% of the patients who had the Crystalens implanted in both eyes could see 20/25 or better at distance. 96% could see 20/20 at arm's length, and 73% could see 20/25 at near without glasses or contact lenses. 98% of these people could pass their driver's test. 100% could see their computer and dashboard, read the prices in the supermarket, or put on their makeup. And 98% could read the telephone book or newspaper, all without glasses or contact lenses. Now, let's try a short quiz to see how well you understood the information in the program. Please mark your answers on your consent form. True or false? It may take months to a year for your eyes to reach their full focusing potential. You will be light sensitive for a week or two after the procedure, and you will need sunglasses and reading glasses during that period. Everyone who has a Crystalens implant will have 20/20 vision at distance, intermediate, and near. You may prefer to wear glasses from time to time after surgery, especially at night or in low light levels. It is not important to keep your follow-up appointments after surgery. This video contained a list of all potential risks, complications, and side effects that could possibly occur. The more you try to read without reading glasses, the quicker you will be able to read without them. Crystalens is not the only type of implant available to you. It is normal to notice a difference in your vision from one eye to the other after your eyes heal. Your doctor cannot guarantee that you will have the results you desire after the procedure. When you have completed this quiz, please grade your own test by comparing your answers to those found on the bottom of the page. If you have any questions or would like to watch this program again, please be sure to ask for assistance. Thank you.